I want to try and compress those SI joints together. The way to do that is you find your ASISs. Okay, you're ticklish?
Kind of.
Okay, so I've got one ASIS and I've got the other ASIS, okay? I just take my palms and I'm putting it on each ASIS, okay? And see how my arms are crossed? Because I want to try, if I go like this, it's a little bit harder. It's a little bit harder to try and wrap it around. This way we're really getting more of a lateral push, and that's really compressing that SI joint in the back, okay? So one palm on each ASIS, and I'm just pushing apart, okay? Doesn't need a lot, but it's gonna put stress on that low back. If, again, they're already coming with pain, so if they have increased pain with this, it's a positive sign for SI joint dysfunction, okay? So crossing your hands and pushing away from each other, okay? Really compressing the SI joint. Increased pain is a positive sign for SI joint dysfunction, okay? So that's SI compression. SI distraction, I'll have you lay on your side facing James. And then scoot all the way towards me. I won't let you fall off the table, I promise. Okay? And so just bend your knees a little bit. Okay, so for SI distraction, you have them in a side-lying position. Okay? Knees bent for stability and to kind of put the pelvis in a neutral position. Okay? I'm finding her iliac crest. Okay? And then all I'm doing is I'm applying a downward and slightly anterior pressure. So before, how we were putting more of a lateral pressure to compress that SI, now I want to put a down and anterior pressure to try and open up that SI joint a little bit. Okay? Give it some relief. So instead of compressing it, we're distracting it and trying to give it some relief. And so all I'm doing is I'm just putting slight anterior and downward pressure or lateral pressure, okay? Or medial pressure. That's all it is. Doesn't take a lot to rotate those hips, okay? But if this relieves their symptoms, so they have back pain, typically it'll be sharp or shooting back pain, and this relieves it a little bit, that's going to be a positive test, okay? Again, saying that they have SI joint dysfunction and relieving it, distraction of the SI joint relieves it, okay?
So both are positive tests for SI joint.
Yep, so whereas before increased pain was a positive sign, here decreased pain is a positive sign. But that's confirming an SI joint dysfunction. Okay?
Okay.
Is that any questions with that?
Not
No
yet.
question with the SI joint
So
compression.
compression is if you increase the pain, that's positive, and with distraction, if it decreases the pain, that's positive.
You got it. Yep. And then the other one that I have you guys practice, I'll have you sit up and just hang your knees over the end of the table here. Just like you're sitting on the table. All right. So this is the Valsalva, also called the Valsalva maneuver. With this one, all you do is you have the patient or athlete make a fist, if that's okay, and then you have them bring it up to the mouth, and you have them blow in the fist as hard as they can with the fist to their mouth. What we're trying to do is we're trying to increase this intra-abdominal pressure, okay, to really put some pressure or really stress the discs, okay, the lumbar discs. And so you want them to blow into their fist and try and not let the air out. So it's more like as if you're blowing up a balloon, but you're not letting that air out.
How long you should do that?
You can do it for 5 seconds, okay? They should feel pretty immediately. They'll either feel like a shooting or typically be a shooting pain either in their buttocks, their hamstring, or down in their calf. And what that is, that's the positive sign. So if there's shooting, pain, or sometimes they'll even get some numbness or tingling, those are positive signs for disc pathology, okay? So whether it's a disc herniation or a complete disc propulsion, either way, it's called disc pathology, and it's a positive sign to have shooting pain or the numbness, tingling into the lower extremity, okay? And so they're trying not to let the air escape. It's not, I've also heard other people say reproducing a bowel movement.
Yeah.
Sounds kind of gross, so I decided to go with the blowing up the balloon, not letting the air out. Okay? So try it.
Wait, so for that one, it's really about what they tell you?
Yeah. So while they're doing it, so after the 5 seconds, they'll be like, yeah, I had some shooting pain down my legs. Or, you know, I felt some tingling in my toes or whatever. So try the